Assalamualaikum and greetings to our lecturer Dr. Santivana and my fellow classmates. We are Group 8 and today we're going to present about gout. Our group member consists of Asparina, Muhammad Luqmanul Hakim, Nur Fasha Shahira, Atis Adiba, Iril Irfan, Nur Anis Izati and me myself, Wan Yulidia Fazana. Introduction. Gout is a form of inflammatory arthritis that causes pain and swelling in your joints. It happens because of excessive amount of uric acid in the blood and tissues that will form crystal in your joints. It commonly affects your big toe joint, but it can also affect your other joints like knees, ankles, and elbows. Symptoms that recur in episodes is called flares or gout attacks. Moving on to normal physiology of uric acid. When you consume purine in your diet, like you eat meat, seafood, or drink alcohol beverages, liver will break down those purines into uric acid. Normal serum uric acid in men is below than 7 mg per deciliter, while in women is below than 6 mg per deciliter. About 70% of uric acid will be filtered and excreted by kidneys via urine, and other 30% will be breakdown in intestine and excreted via feces. If there is an excessive amount of uric acid that is higher than normal serum uric acid, it will form crystal in your joint that will cause pain.
So first of all, we have weight. By being overweight or obese, we can increase the risk of getting gout. So body will produce more uric acid and the kidney will have harder time to clear it out. Next, we have medications where certain medicine can raise uric acid levels in the body. For example, diuretic drugs or low-dose aspirin. And next, we have age and sexes where men are more likely to get gout. The ages is between 30 to 50. And for women, there is usually increase after menopause. Next, we have diet, where eat or drink things that have high purines can increase uric acid production. So, some of the trigger including red meat, organs, and sardine. Alcohol and beverages also become the major contributor. Moving on is the lifestyle factor, where excessive consumption of alcohols and dehydration can concentrate the uric acid, thus increasing the risk of an attack. So next is the genetic and family history, where higher risk of getting gout if close family members have gout. So inherited tendency for body to either produce too much uric acid or have trouble eliminating it. Last but not least is the medical condition, where other existing health problems can increase the risk of getting gout. For example, high blood pressure, diabetes, metabolic syndrome, and kidney diseases. This condition can harder to excrete the uric acid, so thus increasing the risk of getting gout.
Hello, my name is Arfarina binti Azhar and I will be presenting signs and symptoms of gout. We have three, which is acute attack symptom, chronic gout symptom, and lastly mild symptom. First, for the acute attack, there we have severe joint pain, usually start during night. Then we have swelling of the joint. The affected joint will become visible, and we have redness and warm. The affected part of the skin, when we touch it will become warm. Then the tenderness, even to light touch, and limited movement of the joint due to the pain and swelling. Then we have the chronic symptom, tophi, which is hard lumps under the skin in chronic cases. And lastly, for chronic gout is recurrent attack, which is repeated episode of pain and swelling over months or year. Lastly, we have systemic symptom. We have two, which is mild fever during acute attack, and lastly is feeling fatigue or malaise during severe attack. That's all for me. Thank you.
First, gout starts with uric production and homeostasis. Purines come from our diet and also from normal cell turnover in the body. These purines are metabolized into uric acid. Normally, about 2/3 of uric acid is excreted by the kidney through urine, while the rest is removed via the intestine. When uric acid production is too high or excretion is reduced, hyperuricemia will occur, causing uric acid to accumulate in the blood. Next is monosodium urate or MSU crystallization. When uric acid levels becomes too high, the blood becomes supersaturated with the uric acid. uric acid then binds with sodium and form monosodium urate crystals, which are needle-shaped. These crystals tend to deposit in joint, especially in cooler and peripheral areas like the toes. This crystal deposition is the key trigger that leads to gout attacks. And then, MSU crystal-induced inflammation. The deposited MSU crystals are recognized as foreign by immune cell, particularly macrophage. However, these cells are unable to digest the crystals, leading to the release of inflammatory mediator such as prostaglandin. This process attracts neutrophils to the joint, which release enzymes that damage surrounding tissue, resulting in severe pain, redness, swelling, and also inflammation. The last one is tophaceous disease. In chronic or uncontrolled gout, continuous crystal deposition leads to the formation of tophi. Tophi are hard, chalky nodules made of MSU crystal. Over time, this deposit can destroy joint cartilage, deform joints, and restrict movement. This stage represents advanced gout and can significantly impair a patient's quality of life.
Okay, next I will explain the diagnosis of gout. First, we look at the clinical features. Gout is suspected when a patient presents with a sudden onset of severe joint pain, accompanied by redness, warmth, and swelling. The most commonly affected joint is the big toe, also known as the metatarsophalangeal or MTP. Okay, next I will explain the diagnosis of gout. First, we look at the clinical features. Gout is suspected when a patient presents with a sudden onset of severe joint pain, accompanied by redness, warmth, and swelling. The most commonly affected joint is the big toe, also known as the metatarsophalangeal or MTP joint. These attacks usually peak quickly and may recur over time, which is quite characteristic of gout. Next is serum uric acid level. High serum uric acid can support the diagnosis, but it is important to note that uric acid levels may be normal during an acute attack. Therefore, serum uric acid alone cannot be used to confirm gout. The gold standards for diagnosis is synovial fluid analysis. This involves joint aspiration where the fluid is examined under polarized light microscopy. The presence of needle-shaped, negatively birefringent monosodium urate crystals confirm the diagnosis of gout. Lastly, we have imaging. Ultrasounds can show the double contour sign, which represents uric crystal deposition on the surface of cartilage. If joint aspiration is not possible, dual energy CT scan can be used to detect uric crystals deposits.
Next, I will explain the treatment of gout. Gout treatment can be divided into two main goals: treating acute gout attacks and preventing gout complication. First, for acute gout attacks, the aim is to reduce pain and inflammation. The medication commonly used include colchicine, NSAIDs, and corticosteroid. Colchicine helps to reduce inflammation caused by uric acid crystal deposition, while NSAIDs and corticosteroid help relieve pain, swelling, and redness during an acute attack. Next, to prevent gout complication, the focus is on lowering the uric acid level in the blood. Drugs such as allopurinol and febuxostat work by reducing uric acid production, while probenecid increases the excretion of uric acid through the kidneys. These medications are usually taken long-term to prevent recurrent gout attacks and complications such as joint damage. In summary, acute gout attacks are treated with anti-inflammatory drugs, while long-term management aims to control uric acid levels to prevent future complications.
So we move on to the last part of our presentation for gout, which is the conclusion. So to conclude that gout is caused by many types of disorders which trigger inflammation on the joint. This is caused by hyperuricemia, which is the elevated uric acid in the blood. And how do you treat gout? The first thing that you can do is take anti-inflammatory medicine such as NSAIDs or colchicine to quickly relieve the pain and swelling. Or you can also undergo urate lowering therapy or ULT such as allopurinol or febuxostat to maintain your uric acid level on the target area. That's all from me.